joining me today for this really important conversation. And I want to thank all of our participants for their willingness to share your stories. I'm grateful today to be joined by such passionate disability activists, people with disabilities and their families for this really critical conversation. I know that each and one of you have faced challenges, and I want to hear about your experiences because your voices will help us build the caregiving infrastructure the disability community so desperately needs. Every single person with a disability has the right to live an independent life in their community, and for many, that means they need access to home and community-based services. These critical services ensure that people with disabilities can get the care they need to stay healthy and to live their daily lives. And these are the basics. They're the foundation that everyone needs in order to thrive. But for so many people, getting this care is an uphill battle, and that is just unacceptable. Right now, it can take families years to get off a wait list if they're even able to get home care at all. It shouldn't be this hard to be able to live in their community rather than an institution. And these challenges are all the more difficult for people of color who have disabilities. And at the same time, our care workers, who disproportionately are women of color, make poverty level wages and have little to no benefits. So for years, we have been fighting for better care for people with disabilities, better pay and benefits for our care workers, and a better quality of life for Washington State families. So I am proud to say that the American Rescue Plan paved the way to build back a better, more inclusive country. But of course, our work is just beginning. We need an historic investment in home and community-based services and in the critical workers who provide this care. And that is exactly what the American Jobs Plan will do. The president's $400 billion plan will help make home and community-based services available to every eligible American that will make sure that people with disabilities can thrive at home, at work, at school, and with their families, friends, and neighbors. And it will invest in the essential workforce that provides those services, ultimately, by the way, creating thousands of new jobs. So I want you all to know I'm going to be fighting tooth and nail to get this important bill across the finish line. And I want to take your stories that you're sharing with us today back to that other Washington, because together I know that we can build a more inclusive, accessible country. So I'm delighted to have some folks with us today to talk about their personal stories. And I'm going to start by introducing Stacy Dim. She is the executive director of the ARC of King County. This is an organization that fights for the full inclusion of people with intellectual and developmental disabilities. So Stacy, thank you so much for joining us today. I will turn it over to you.
Oh, thank you, Senator Murray. Hi, I am Stacy Dim. I'm actually the executive of the ARC of Washington State.
Well, there you go.
King County last year. But I'm also the sibling of someone with a developmental disability. And again, I can't thank you enough, Senator Murray, for this truly historical conversation about the critical importance of home and community-based care for people with disabilities. You may know the ARC is a national organization leading advocacy across the United States. And we encourage progressive governmental policies like these that promote independence and self-sufficiency and inclusion for people with intellectual and developmental disabilities in every community. As a sibling, my sister has a developmental disability and lives in the community with the benefit of a home and community-based waiver. Because my mom has advanced dementia, I'm also my sister's guardian and close support. And I can say through the lens of my profession and as a family member, this investment through the American Jobs Act is unprecedented and a game changer. We also know this is a funding package that will be the bridge to the Home and Community-Based Access Act. And I'd be remiss not to thank you for moving this piece of landmark legislation as well. The two most pressing issues in our state, of course, are the wait list and the fragility of the direct care workforce. In our state, over 78% of people with developmental disabilities live with their family, and we must support family caregivers and the caregiving workforce so that people with developmental disabilities have the opportunity to live outside their family home in the community over their lifetimes as well. And we're fortunate that my sister was able to get a home and community-based waiver and lives in supported living in the community. And this waiver has been critical to her happiness, her autonomy, and to the preservation of our family. There was a time that my sister was in crisis and she was institutionalized, and it's not where she belonged. As soon as we were able, we waived her right to be in an institution and asked for community-based care. And I just want to let that soak in for a minute. Think about what it means to only have the so-called right to institutional care and not live in your community to be supported, to be independent. So we're one of the lucky ones. In Washington, we have over 15,000 people waiting for services to live their lives in the community. And we have to look at the barriers that people with developmental disabilities face. This American Jobs infusion of community infrastructure, and with the HAA's elimination of the federal Medicaid institutional bias so that the community is an entitlement, it will be transformative. We are hopeful that you'll also look at ensuring efforts to look at portability between states and provide for a basic, robust floor of services that can be offered to everyone, no matter where they live. We have people with developmental disabilities who are homeless because we lack these options. During COVID, I've been contacted by too many siblings who have had a sudden loss of their parent to COVID and are now in the position of having to bring their brother or sister with developmental disabilities to live in Washington from another state. And I have to tell you, there's few options here for their supports and services, whether that's for residential or employment supports or day supports or other therapies that their sibling may need. It's hard enough for people to have a sudden loss of their parent and for siblings to take on these new roles, but we have to eliminate options that force people and their families into situations that don't meet their needs or give them no choice at all. And as someone who works every day with staff who support my sister, we need a well-trained community-based workforce who make enough wages to live on and not have to work 2 or 3 jobs to make ends meet and to care for their own families. So I want to thank you again for your tremendous, insightful understanding that as a nation, we've left people with developmental disabilities and their families and their caregivers behind, and that we can do better. People with developmental disabilities have an inherent value and enduring potential, and they want the same lives that we all have. So thank you again very much. And I think I'll turn it over to Whitney.
Yes, thank you, Stacy, and thank you, Senator. My name is Whitney Store. I live in Linwood, Washington, just north of Seattle with my husband, Jason, and our 3-year-old son, Malachi. I'm a nonprofit manager. My husband works in sales, and Malachi is our amazing little preschooler. He is currently attending school through remote learning. He's absolutely excelling in that environment and loves interacting with his friends. He enjoys being outside, and we take daily advantage of the amazing community parks near our home. Malachi is also a medically complex little guy who was born with spina bifida and congenital heart defects. He has epilepsy, hydrocephalus, and a host of other conditions. He is a wheelchair user and is trach and ventilator dependent. He was born in January 2018 and immediately transferred to Seattle Children's Hospital. He had 5 life-saving surgeries in the first 5 months of his life. In fact, he spent over 15 months of his first 2 years of life in the hospital. But right now, he is home. He lives with us. He gets to sleep in his own bed, play in his backyard, zoom around our house in his little wheelchair. But he also has a lot of needs. Malachi requires 24-hour nursing care, positions which are notoriously hard to fill, and which we don't currently have staffed. Someone has to go to school with him. 2 people are needed for transportation anywhere. He receives physical and occupational and speech therapy. Someone needs to manage his medications, his equipment, his meals. He needs someone to work with him on feeding therapy, someone to help him with his communication devices. And of course, someone must always be medically trained for emergencies, which happen fairly frequently in our home. If I were to hear our story from an outside perspective, certainly I would question how any middle-class family could afford it. How do you afford months in the hospital, the medical bills, the daily expenses, the lost economic opportunity for parents? And the truth is that we are lucky. It's a misconception, I think, nationwide that kids with disabilities automatically qualify for Medicaid and home and community-based services. I know in some states that's true. And those families are very lucky. And certainly it should be nationwide, but as it stands in Washington, state insurance and home and community-based services are still restricted by income. And that leaves middle-class families like us with really few options. Either we find a way to impoverish ourselves in order to qualify our kids for the services they need, or we are lucky enough to receive an income waiver. And Malachi received one of those waivers, which qualifies him for Medicaid and home services. He was lucky because, as was said in Washington, there are thousands of eligible individuals waiting for waivers so that they can receive those services too. Malachi lives outside of the hospital because he was lucky enough to be chosen from the wait list. He benefits from personal care services. We benefit from respite care because he was lucky. He has the equipment needs he met because he was lucky. His dad and I have been able to continue working and saving and putting money away for our own retirement, our own future, because he was lucky. Our family is still functioning because Malachi was one of the lucky kids that was able to access healthcare and the services he needs. Caregiving is infrastructure. The programs that support caregiving are infrastructure, the guaranteed availability of home and community-based services that support the programs that support caregiving are infrastructure. Because whether or not someone gets to live in their home, whether or not they have the personal care they need, whether or not their family is able to maintain economic stability, that shouldn't be a matter of luck. It should be a matter of right, and it needs to be a matter of right. So I thank you again for inviting me here today to share our story. And I'm gonna pass it on to Holly and Kathy.
There you go. Ready? Speak up. You ready to go?
Hi, my name is Holly Noel Marhausen. I am 33 years old. I live at home with my mom, my dad, my brother. I have worked at one of the Microsoft Cafe for 7 years. I work at 5 days a week for 4 years a day. I ride the bus. I love my job and my coworkers. My job coach helps me be sure I do my job well. Someday I want to live in an apartment with my friends. I want to have a cat. I would like to have a boyfriend and get married. My family helps me by taking me to the store, to my doctor's appointment, helps me with my money and manages. Thank you.
Thank you, Holly. Good afternoon, and thank you, Senator Murray, for this opportunity. We are so very grateful that we have a home and community-based services. Holly's waiver has provided job coaching, personal care for her, and respite to us so that we can have a break. We won't always be able to care for her, and we need to be assured that she has the services that she needs when she needs them. We don't want to have to wait for a crisis and then have to accept a slot in a facility that only takes care of her health and safety needs. We want to be able to plan for her hopes and dreams and desires, for her to be as independent as she is able, and that her desires are honored and that she continues to live a meaningful and active life in the community. We are so excited that this investment may help us breathe a little easier. Thank you. And I'm passing it along to Julie.
Thank you, Senator Murray, for holding a press conference. This is really important work. My name is Julie Clark, and I am using my Tobii Dynabox speech device to share my message about why I feel no one needs to live in an institutional setting. These are my own words, and my speech device will help me get them out clearly. Cerebral palsy is my disability. I am 54 years old and I live in Olympia, Washington. I was in Western State Hospital for 3 months in 2001. COCUA is a residential provider, and they got me out of the hospital in September of that year and put me into my apartment with day and evening caregivers. I was in independent living. In independent living, my caregivers did cook and clean. I was able to come and go as I pleased. My transportation was using public transportation. Being independent was especially important to me because I could set my schedule. I chose how to run my life. I worked for the Department of Health and Human Services as a secretary for 17 years before I retired in 2018. Working was essential to me because I was involved, contributing to my community. I was an important member of that organization for many years. The United Churches of Olympia is my church, and I have been going there for over 25 years. I am an active member of my church. The church is important to me. As I aged, I could not take care of myself. I needed to have 24-hour care. So, COCUA placed me in a shared home that COCUA runs. I had a roommate who was yelling all the time. My roommate would assault the caregivers. Being in the shared home was not safe for me. In November 2019, I moved to an apartment in Lacey with COCUA's help. I get 24-hour care. A nurse comes to check up on me because my hair is high. I have a feeding tube, vest chest compression machine, and Hoyer lift. My caregivers go everywhere I go. It is nice to be living on my own again. I was in and out of the hospital with pneumonia for the last 6 months of 2019. Shelley is a nurse that COCUA hired. She has taught me how to breathe better. I have not been to the hospital with Shelley's help since January 2020. I am in community inclusion, a part of a supported employment program that allows me to continue to be active in my community now that I am retired. It is still essential for me to be involved in the community. I do a lot of advocacy and volunteer work. When I was in an institution, I could not do what I can do in the community. I am pleased to be in the community to set my schedule and be involved in whatever activities I choose. I have all the freedom that my health will allow, and I am grateful to be an active part of my community. A group of self-advocates was formed known as the Shut Them Down Coalition, and I am a member of this group. This group wants to close all the residential rehabilitation centers, RHC, to allow all of these individuals to be active members of their community. I strongly believe that all disabled people should live in the community and that nobody should live in an RHC. Will you sign a petition to shut them down? Thanks again, Senator Murray.
And I give it over to Hannah.
Thank you so much, Julie. Thank you again, Senator Murray, for this opportunity and for speaking with our community today. My name is Hannah Langley, and I am coming to you from Seattle. I wear many hats, one of them being a client with the Alliance of People with Disabilities, who asked me to be here with you today. I have benefited from home and community services for the majority of my life in both Alaska and Washington, and it has been an integral part in everything that I do. I have graduated from the University of Washington and am currently pursuing my master's in elementary education. I took a break from my third grade students internship to be here with you today. Home and community-based services enables me to live a free and independent life the way I so choose. When I was younger, my family worried if they were going to have those hard conversations with my younger sibling
and other family members about what was going to happen to me when they're no longer around. Because I receive home and community-based services, I'm able to live independently in an apartment with the assistance of several caregivers. I have been living independently of my family for 10 years now in Seattle. I would like to address for a moment the opportunities that this legislation would give to the caregivers and direct support staff that support us every day with augmentations like those in the American Jobs Plan. Our caregivers can continue to receive union benefits and those living wages which they deserve, and will prevent high turnover and crisis situations within the home care community. As I was sitting here listening to other people's stories, I realized that I've been able to have the life that so many people want for their children with disabilities. And this is in large part to receiving home and community-based services. I would not be able to achieve the things that I have and be able to make a steady career for myself without these services. I wouldn't even be able to get out of bed on my own. So with that, I thank you for having us here today, Senator, and we appreciate your support. With that, I'll turn it back over to Amir for questions and answers. Thank you.
Thank you so much, Hannah. So to our reporters, please just use the raise your hand function to ask a question, and we'll take questions in that order. And you'll see that at the bottom of your screen under reactions. Okay, if you're not able to use the raise your hand function, I would go ahead at this time and unmute yourself to ask your question. I think we had a couple people who expressed interest.
Thank you very much, Amir. Eric Garcia, freelance journalist for Jurisprudence. What Senator Murray, given the fact that the nature of there's only 50 senators, 51 if you're including Vice President Harris, what are the ways and what are the methods you are willing to use and utilize to ensure that home and community-based services included, given that Republicans have not wanted, their proposal doesn't include home and community-based care?
Eric, thank you so much for that question. I want to thank all of our participants today. Their stories tell you exactly what I need to do, which is to work any way we can to make sure at this really critical time, we include all of the provisions of the president's package, including the home and community-based services part. If Republicans refuse to see people's needs at this time, we will have to move forward under reconciliation in the Senate, which is a difficult, challenging way to get a bill passed, but we're going to pursue all options because as we have heard from folks today, and as we have seen for a long time, but particularly in the last year with coronavirus, where people with disabilities have not been able to get access to caregivers because our caregiving community also was impacted because we see today so many people who, because they have an independent life, can contribute back, can make a living, can do so many things on their own. It economically makes sense. It health-wise makes sense. It is the right thing for a compassionate country, and we will pursue all options to get this done.
Thank you, Eric. Anyone else who has a question, please go ahead and unmute yourself at this time. Okay, seeing no other questions from the reporters that we have on, I will go ahead and turn it back over to Senator Murray.
Well, thank you. I want to thank all of our participants again for your courage, for your willingness to share your story. You speak for so many people who cannot speak out today. And I want you to know I'm going to carry your stories and what you told us today back to Washington, D.C., that other Washington, to do everything we can at this really critical time to provide the support and services so everyone can live an independent life. Thank you.
Thank you, folks. That concludes today's press call. As a reminder, this was recorded. Recording of today's press call will be included in our press release. And if you have any follow-up questions, you know where to find us. Thank you.
Thank you, everyone.